If you've been having pain or tightness in the front side of your hip or even into the low back, you might have a really tight psoas muscle. The psoas is your hip flexor. Its job is to bring your knee closer to your chest, or vice versa, your chest down closer towards your knee. It flexes the hip. This psoas muscle gets shortened and tight over time from things like sitting or bike riding, anything where you're in this forward bent flexed position for long periods of time. This is problematic because that psoas muscle also attaches to the front side of your lumbar vertebra. So if you've been in chiropractic care, getting your low back adjusted, relieving the tension in the spine, but if you're still having that pain or tightness in the front side of the hip, you might have a really tight hip flexor muscle. So in this video, I'm going to show you a simple strategy for how to roll out your psoas to help break up that tight muscle and tight fibers to help relieve the tension not only in your hip, but also in your low back. All right, in order to foam roll our hip flexor, that psoas muscle properly, you're gonna need a foam roller of some kind and a place to foam roll. So the psoas is between your pubic bone and your hip bone. Draw a line straight in the middle there and coming riding up through that front side all the way into your diaphragm and also down into the quad is that psoas muscle. So that is where we're gonna place our foam roller. Let's go put the foam roller down on the ground and then find a point where you've been noticing some of that pain or tension in the front part of your hip. In this spot, I can just apply pressure downward and feel how that might be starting to break up any tight tissues. But before we do this, before we start to roll or move our body in any way, I want to make sure that we are really helping to stabilize our low back so that we are providing support and not causing more injury. So in order to do this, I want you to take a huge breath into your low back. Maintain that space there as you breathe out and as you are creating intra-abdominal pressure. So pressure within your abdomen, you're stabilizing your spine. So from here, you can just apply pressure downward, sinking into any tight fibers, or you can also rotate your body side to side to find other areas of that psoas, getting the entire muscle group and fibers around it to start to break up. In this position, I can find a really tight tissue by rolling forward and back. Find that specific spot that it feels to you like is really bound up. And then in this position, we can do what I call a pin and stretch. So find that place, apply pressure down, and then in this position, you're gonna start to bend your knee. As you bend your knee, that will lengthen the psoas underneath your hip, and you'll really start to feel those fibers start to stretch underneath that tight spot. You can shift your body weight, go into another area, and again, bend and straighten that leg to really help break up that psoas muscle. If you want to get an even better stretch underneath the foam roller, we can use our breath as the psoas muscle wraps up into the diaphragm. So as you breathe in and out, the psoas is going to get lengthened as well. So you can take huge breaths in and forceful exhale as you bend your leg, and that'll lengthen the psoas even more underneath your leg. So play with this. After a bike ride, after you've been sitting for long periods of time, you can really help to relieve a lot of that tension in the psoas into your quad and into the low back by foam rolling your psoas muscle. If you have any questions or concerns, other strategies for how to relieve tension in your psoas and low back, please leave them as a comment below. Again, my name is Dr. Jordan Fairley, and I hope this is beneficial for you. Please share with your friends. I'll see you soon.